See You Now is a podcast highlighting the innovative and human-centered solutions that nurses are coming up with to solve for today's most challenging healthcare problems. Created in collaboration with Johnson & Johnson and the American Nurses Association and hosted by nurse economist and health tech specialist Shauna Butler.
I'm Shauna Butler, the host of See You Now, a podcast that shines a light on how nurses are addressing today's most challenging healthcare problems. And never has that light been as essential as it is at this moment. Over the past few weeks, See You Now paused its regular format so we could share stories of how nurses on the front lines of care are responding to the coronavirus pandemic. And in doing so, we've broadened the notion and understanding of the front line. To stop the spread of the coronavirus and protect those most vulnerable, around the world, we were asked to stay home, to shelter in place. But what happens to those who don't have a home, were told to leave their home, or whose home means incarceration? In this episode of See You Now, we zoom into Chicago to visit with Dawn Bounds, a psychiatric mental health nurse practitioner and researcher, who introduces us to an often forgotten and marginalized group of individuals who are some of the most adversely impacted by COVID-19 and whose experiences and circumstances personify and underscore how a single pandemic can trigger a series of pandemics.
Educated, successful adults are struggling during this time. Let's consider the young person who's homeless, who has now been cut off from that school tether, who might not have an established support system in place, who's still trying to navigate taking medication for a mental health diagnosis, who now has to follow additional rules about when they can grocery shop and when they can go outside and when they can leave their room. It's a hard thing to swallow. My name is Dawn Bounds, and I am a psychiatric mental health nurse practitioner who is also a researcher. Most recently, my work has been with homeless youth. However, prior to that, I worked at Cook County Juvenile Detention Center, so working in juvenile justice. I've worked in school-based health centers on the west side of Chicago. And so I kind of combine youth and juvenile justice, youth in care, and homeless youth as what I say are youth who have socially complex needs. And a lot of times those are individuals who have been forgotten. And I use the word forgotten intentionally because it's easier to look away. Overwhelmingly, these are youth of color and these are LGBT youth. And so there is a huge disparity when it comes to contact with law enforcement and juvenile justice system, when it comes to the inequities in terms of poverty and education. And they experience homelessness in a variety of different ways. Sometimes their entire family has experienced homelessness. Sometimes they've left a home that they felt wasn't the best environment for them. And sometimes they were asked to leave. They were kicked out. COVID-19 and sheltering in place had a huge impact on the young people that I work with. They are already isolated, living in a homeless shelter with other homeless youth, and they had to shelter in place within that environment. There were situations when young people got frustrated and they left. Some of these young people's coping skill is to run when things get tough. And so we're now faced with sheltering in place and then running. And so these were really hard things to navigate for the young people, also for that shelter system. For the youth I work with, really healthy relationships that exist for them in terms of those trusted adults. They're at school. And in a blink of an eye, they were cut off. What's on my heart today as a nurse, as a mother of an African-American boy, as a wife to an African-American man, is the country's long history of violence against Black people and people of color. I'll never forget when I worked in juvenile justice, and I remember like my first time being there, my first time touring and walking around that place, and I was heartbroken because unit after unit after unit, all I saw were Black and brown boys. And over the years of working there, I actually saw them grow up there. I recall working in juvenile justice years ago, and boys would tell me that the police beat up my brother or my cousin or my friend, or the police shot such and such. And back then, it was stories. I hadn't heard it on the news. I hadn't watched a video of it occurring. So there was lots of distance. It hurt to hear those stories. I saw and witnessed the impact it had on that boy sitting in front of me. But now we're in a different time where we are inundated with images of brutality, of unarmed Black men and women for that matter. And the response is bubbling up in ways that are devastating for communities. It's going to have and continue to have a mental health impact, not just on Black people or people of color. It's going to have an impact on everyone. It's already having an impact on everyone. Whether we choose to believe it and accept it and acknowledge it is up to each individual person. But the fact remains, it's impacting us all. We have a responsibility to young people to not look the other way.
COVID-19 has brought into sharp, glaring focus the many inequities, disparities, injustices, and indignities that have existed for a long time, and how those inequities show up in our health experience and health outcomes and in our deaths. These issues are bound up in the history of this country. In 2012, at one of the major technology and innovation conferences, human rights attorney Brian Stevenson delivered a talk about racial inequality and injustice that brought the fast-moving techno-optimist community to a standstill. He shared his belief that when we don't care about the difficult things, that the positive things like technology, innovation, and creativity, they become overshadowed by the suffering, abuse, degradation, and marginalization. That ultimately, our society and citizens will be remembered and judged by how they treat the poor, the condemned, the incarcerated. He said, because it's in that nexus we understand truly profound things about our identity and who we are. Social justice is just a core nursing value, the foundation of public health nursing, and espoused in the American Nurses Association Code of Ethics. It's part of our identity. And yet, as we've seen with COVID-19, significant disparities in healthcare continue, especially for Black and brown people. Nurses have made it clear, we will not be silent. We will not stand by. Together, we can, we will, and we must do better. And we will not look away. For See You Now, I'm Shauna Butler. Thanks for listening.
Johnson & Johnson is proud to power up nurse-led innovation that is transforming health outcomes through skill building, leadership development, and more. The American Nurses Association ignites and celebrates nurse-led innovation to redefine quality nursing and advance healthcare for all. Johnson & Johnson and the American Nurses Foundation are excited to launch the Coronavirus Response Fund for Nurses. Go to the American Nurses Foundation website to learn more, share, or donate. And thanks.